Help! Help!
Going out to the bars,
I'm feeling pretty lazy.
yeah, I don't know, I just can't wait to get off work.
I know. Oh man, it's almost
I know.
Our group chose to do our EBP project at the Bethesda North Hospital on the telemetry floor. Bed alarms are very important and they can help prevent falls and facilitate better communication among nurses. They really help in hospitals to make sure that patients are in a safe environment. Our PICO question is, in patients on the telemetry floor at Bethesda North Hospital, what is the effect of the current bed alarms in comparison to a potential new system of bed alarms on the patient fall rate and hypersensitivity of the floor nurses? To collect our data, we use CINAHL database and we use keywords bed alarm, nurses, fall risk, noise reduction. We found articles within the past 5 years. Our recommendations is to improve communication, introduce wireless device, increase sensitivity in nurses, and reduce falls. Current clinical practice at Bethesda North Hospital is for hospital personnel and staff to respond based on their location. Whoever is closest to the call and anyone available within the vicinity should respond to the call light. The evidence that we found compared to current clinical practice is that call lights are effective in alerting nurses and bettering communication, although different distractions may limit the nurse's ability and do not directly prevent falls.
Reducing Hospital Noise, a review of medical device alarm management, is a systemic review that studied 27 various journal articles regarding bed alarm management. It is a Level 5 good quality article that allows readers to learn about previous interventions that were conducted to increase the sensitivity of nurses to bed alarms. Research found reasons as to why nurses weren't quick in attending to the alarms, and it came up with ways on how to make nurses more responsive in the future.
Excellence in Action, Developing and Implementing a Fall Prevention Program is an article summarizing an experiment at the University Medical Center at Princeton in collaboration with the Hill-Rom Clinical Excellence Team to design, implement, and monitor a new fall prevention program. It focused on ways to improve communication amongst the interdisciplinary team, introducing a valid assessment tool and appropriate interventions. The Plan, Do, Study, Act improvement model was utilized, and the program was closely monitored and re-evaluated for effectiveness.
Effects of an Intervention to Increase Bed Alarm Use to Prevent Falls in Hospitalized Patients by Ronald Shore is a Level 1 Quality C research article. It's quantitative and was a pair-matched cluster randomized trial over 18 months. This research study was conducted in one hospital with different floors. Nurses were given education on using bed alarms and how they worked, whereas the control group received no information on bed alarms at all. The limitations to this study was that it was done at only one hospital and did not have very much variation. The sample size was small, which also added to the limitation. The study was inconclusive due to the limitations and lack of evidence to support the hypothesis. The findings did suggest, although, that bed alarms are useful in alerting nurses to help patients, which in turn might reduce falls. Bed alarms themselves are not effective in preventing falls, but do alert the nurses.
The article, Examination of a Wireless Device, was about a research study taking place at a med-surg floor of a hospital. The research study first observed the floor in its normal protocol, then added the use of a wireless device amongst the nurses and CNAs. The research conductors concluded that with the use of this device, communication was enhanced among nurses and other healthcare providers, and that the patient fall rate was lower than the original observation.
Our articles used in this project consist of a Level 1 Quality B, Level 1 Quality C, Level 3 Quality B, and Level 5 Quality B research articles and non-research articles.